Let's think about ADHD from a trauma frame. And you remember in an earlier video, we talked about how trauma often shows up in young children as problems of focus, attention, and persistence. And so it is likely that this is going to be perceived and diagnosed as ADHD. Now, with ADHD, and I'm going to quickly go through the diagnosis. I encourage you to open it up and read this afterwards. But we're seeing a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. So it's problematic. And we see either inattention or hyperactivity. So either one or two of those. And we have to have at least 6 symptoms for at least 6 months when we're talking about inattention. And it's not just oppositional, defiant, hostile behavior or just failing to understand tasks or directions. A lot of carelessness characterizes what we're seeing here. So careless mistakes, variable across time, difficulty sustaining attention, often not listening, not finishing schoolwork. Now, the other problem could be hyperactivity. Again, we're seeing six or more symptoms at least 6 months, and not just a manifestation of oppositional behavior, defiance, hostility, or failure to understand tasks. There's often fidgeting, tapping, squirming, not sitting still in a developmentally appropriate way. So we expect that a 3-year-old is going to squirm in their seat, that they're not going to be able to sit still at church. But we do expect that a 10-year-old should be able to do that. And so we need to be paying attention to both of those. Now, symptoms have to occur before age 12. If they first occur after age 12, then we're going to be thinking about other things that might explain what's going on. Maybe substances, maybe trauma, maybe some other disorder, maybe it wasn't, just wasn't identified before. At least 2 settings. The reason we're saying that is that we want to make sure that we are not just looking at bad parenting, for example. It has to interfere with social, academic, or occupational functioning. And it's not just due to a substance or, another kind of disorder. So compared to children without ADHD, children with ADHD experienced more attachment and environmental trauma events. So they're much more likely to be placed in foster care, more likely to have a history of sexual abuse, more likely to have a history of maltreatment, and they're more likely to experience a parent with substance abuse. So lots of different kinds of things that are going on here, suggesting that what's going on here is, has some sort of trauma base. We know that children are more likely to, children with ADHD are more likely to experience injuries, have difficulty achieving in school, have problems with relationships. Teens are more likely to have problems with self-esteem. They abuse substances and are more likely to have accidents because, driving requires paying attention. And adults are more likely to have problems with income, employment, and the law. Some of these issues are addressed or you can see in these boys in the video as they're describing their history of ADHD. And you also see their use of meditation as a way of responding, of managing their symptoms. So basically building some executive functioning and emotional regulation. So Emmy Neatfeld, we've seen on a couple of different occasions, her mother had a history of hoarding, and now believes that Emmy has ADHD, and she sees herself and her brother as having ADHD. And she says about Emmy, Emmy was disheveled, disorganized, chronically late. And, you want to be thinking, is this different from typical for a teenager? And most damning, when I read, I become hyper-focused. We're just not even going to go there. I think there's this blaming frame that certainly, and symptom finding frame that her mother seems to engage in here. So think about ADHD from a trauma lens. What kinds of problems are we trying to solve with ADHD? What kinds of things are we doing in order to handle the world better? What are we avoiding? Why are we avoiding? And consider the symptoms, as we've been talking about for other disorders, as meaningful in some way. And I'm going to say goodbye, and I'll see you in the next video. Take care.